welcome to CQC Connect, the podcast from the Care Quality Commission. My name's Sam Wallace and I'm the Provider Engagement Lead here at CQC. This is the third and final of our Care at Christmas podcast episodes, where we're sharing stories of how people have come together this year to help and support others during a really challenging time. In this episode, we're going to be speaking to Anne and Mary-Anne, who are both experts by experience. They'll be sharing their experiences of helping others during the pandemic and staying connected with others. I'll start with just a bit of an introduction to our Experts by Experience programme for people who aren't aware of what it is. So the programme looks to involve people who have had recent experience or experience caring for someone who uses health and mental health or social care services. They support our inspections and various other activities, helping us to hear the views and experiences of people who use health and social care services. So, if I start by asking my guests to introduce themselves and say a bit about how and why they became an expert by experience. Mary-Anne, can I start with you?
Hello, I'm Mary-Anne Richardson. I'm down in southeast Kent. I started because I cared for my parents who both had dementia for 10 years. And we managed to all stay at home together with my family. And I missed all the caring once they'd gone. And so now I spend my time talking with lovely residents in care homes, or I did before lockdown.
Thanks, Mary-Anne. And Anne, how about you?
Yeah, hi, I'm Anne Carr. I'm from Durham. I became an expert by experience because I wanted to try and give something back into mental health services that have helped me, but also as well, I've had one or two not so good experiences with my mental health team up here. So I want to try and make sure that people are cared for in a good way.
That's great. Thanks, Anne. So I'd like to start by finding out a bit more about how, Mary-Anne, you've supported others during the pandemic, and we've heard there might be some ponies involved in this.
Yes, well, my children think I'm a bit loopy with it, but I have two little Shetland ponies that are companions for my larger horses. Usually when it's not in the pandemic, I take them around care homes anyway. But since the pandemic, we've been taking them into the gardens of care homes and trotting them around and having all the residents waving out of the windows and shouting lots of encouragement to us. And I also trot them around the local villages here to see all the residents that are lonely here and stuck in their homes and can't get out and about. And we are quite a funny sight, but people do welcome us with open arms and lots of smiley faces. And it's really heartwarming to see how excited people get. And it's good for me too. We love it.
That sounds really, really great. And it sounds like the kind of thing people would really get a lot out of if they're feeling a bit lonely or isolated during these times.
I think they do, and I think especially at this time of year when people feel trapped in their homes, it can be quite miserable at Christmas anyway if they're lonely and don't have friends around. And just to see these two little fluffy faces, even if they don't like animals, they seem to just adore them. And it cheers them up, and the smiles on their faces are incredible. And they just feel like talking, even if they don't normally like talking to people. It just opens all sorts of doors and laughter, really. And we're always welcome wherever we go, even if we forget our poop scoop. Actually, probably a little bit easier now. We're only outside, but it just seems we have so many people even stopping in the streets, and we sort of walk through the churches and things, and there are quite a few lonely people out there, and it's just so nice that we can engage with them and enjoy ourselves. And it's therapy for me as well, because it's such fun.
Yeah, definitely. I can imagine that's really fulfilling, being able to do that kind of thing as well. Anne, I'd be really interested to hear from you about how you've managed to stay connected to others during the pandemic and how that's gone for you.
Yeah, I'm lucky enough here in Durham that we have a facility called the Art Recovery College. It's run by Tees Esk and Weir Valley Trust, and the Recovery College pre-COVID, we used to go into the college and do courses there. on mental health, but also physical health as well, dietary needs and things like that. We had a walking group, we had a singing group, and we had a photography group. And obviously since COVID, things have had to change. So what they've done now is courses online, and we're still doing the walk and the photography courses, but just a few less people. But on the online course for the Recovery College, there's loads of courses on there that can help pick you up and ground you when you're not doing so well. And it's a really good facility that we have to do this. I believe anywhere in the country can now access the Recovery College online, and there's just so many good courses on there to help people with the mental health at a time when, as Marianne said, there's a lot of lonely people about this time of year. And we'd still do the singing, but it's via Teams, so it's a bit strange singing into your laptop. That's a bit weird, but still good fun. And we're still able to connect with people who we know from the college.
That sounds really good, and I can imagine it's such a valuable resource for people to have during the last few months where people have maybe not been able to go out and see people quite as much.
Yes, I mean I've been going there for a couple of years now, and there is a kind of like bank of people who you get to know. A lot of them live alone, and when the lockdown first started, they really missed not being able to meet up with everybody and have a chat and how's your week been and everything. But now with the walking group and everything, we are starting to be able to get together, even in smaller group, but still being able to connect with the people who would have used the college before COVID started.
That's great. Well, thanks for sharing that, Anne, and thanks both for sharing your experiences. I'd be also really interested to hear about any work you've done as an expert by experience during the pandemic and how that's gone. Marianne, can we start with you on that?
Yes, I've done some telephone inspections, which have been brilliant. I do miss actually going into the care homes and meeting people face to face. I think I've probably spent, I don't know whether it's because of the pandemic, I spend longer on each phone call now, and I've really enjoyed chatting to the people, and people have been really keen to just keep talking, really, which is lovely, but also quite sad because a lot of them have been so lonely. But in a way, it's rather nice to be able to have a bit more time to chat to them now.
Yeah, absolutely. And I'm sure they appreciate it as well. Anne, how about you?
Yeah, I've done two. Again, the same as Marianne. I did one with service users for the community mental health team. So I was ringing them at home and having a chat with them. And then I did one for a hospital in Newcastle, but again, it was virtually. We had hoped to speak to some of the residents via Skype, but we couldn't get it up and working. And one of the member of staff at the hospital said, "What about FaceTiming the residents?" And I said, "Yeah, come on, we'll give it a go." So yeah, I spent about an hour talking to the residents via FaceTime, which was good. Difficult at times, people maybe weren't able to communicate as well, but it was really good, and the people, some of the residents really enjoyed speaking to somebody from outside of the hospital as well. Worked really good.
Yeah, and I can imagine that because during COVID, people in various different services have been able to have less visitors or see less people outside of the service. Actually, being able to speak to one of you has probably been a really beneficial experience for them as well. But that sounds really interesting about how we've adapted the work you do to make sure we can still speak to people using services during COVID. I mean, do you think, is this something you can see carrying on as part of the expert by experience role, using things like Skype and FaceTime to talk to people in services, or are you really eager to get back to walking into a service and speaking to people face to face? Mary-Ann, what do you think?
I'm afraid I really don't think there's anything better than sitting in the care home having a chat with someone face to face. Of course, we always do the telephone inspections for domiciliary care, which is brilliant, but I don't think you can beat actually being with them and getting the atmosphere and being face to face. But of course, it's better than nothing doing Zoom meetings and seeing what's going on. But I'm not very good at. I don't really like doing it myself, and I think if you're not used to computers, it must be quite a daunting prospect, really, seeing a funny face on a screen. But better than nothing. And I know my in-laws who are in their 90s and they're now on FaceTime and things, and they're thrilled with it. So I think it is a good way to connect if you can't be there in person.
Yeah, absolutely. And what do you think about the future of using these kind of tools?
I totally agree with Mary-Ann. I think Teams and Zoom and things like that are good for maybe training purposes, with not having to travel to go on training courses and things. But when it comes to going into homes, going into hospitals, I don't think there's any better way of actually physically going there, because you can pick up so many other things, that's happening. Sometimes somebody might be telling you something, but the body's telling you something different. So I think that, going in is the best way possible. Things has a future, I believe, as well.
Yeah, absolutely. So I also be interested to hear if you've got any tips for people listening to the podcast about um, staying physically and mentally well whilst the COVID pandemic continues, and not maybe able to get out and see as many people as possible. Maybe it's something you've been doing or something you've heard other people have been doing. Mary-Ann, what about you?
Well, I'm a bit spoilt, really, because I think my way of keeping sane and happy is being with all my animals and my children, of course, and husband. But I find being outdoors, keeping active with the horses and the dogs and the chickens and the ducks have kept me really busy and happy. So I probably don't really particularly notice we're in lockdown, which is why I like to go out and see other people that aren't as fortunate as myself. But keeping active, I think, is the main bit of advice.
Yeah, that sounds like a really good tip that loads of people definitely find beneficial. Anne, what do you think people could be doing?
Yeah, again, I've got to agree with Mary-Ann. I have a young dog, she's only 14 months old, and we try to get out with her as best we can. But yesterday we were down the beach with her, and we were down there, and there was lots and lots of people out walking the dogs, and it was lovely. But apart from that, if I can't get out the house, when I'm feeling down, I have to put something. I put something funny on the TV. Even if it's something that I've watched 100 times before, I put something on the TV and try and have a laugh, cheer myself up like that. It tends to work as well. But I like to be outdoors with my dog and my daughter.
Great, thanks both. They all sound like really good tips for others. So I just want to say thank you both for joining us and sharing your stories, and obviously thank you for all the work you do as experts by experience as well. That's really valuable work. And thank you to everyone for listening. That's unfortunately all we've got time for in this episode of CQC Connect, but do look out for more episodes in the new year. If you want to share how you've supported others or the community this year, get involved on Twitter. Follow us on @CQCProf and tag your posts using the hashtag #CareAtChristmas. Thanks again for listening.